Welcome to Dental Vibes. I'm Gabby.
And I'm Carla.
And if you're new here, we have been dental assistants for over a decade, and we share a passion for dentistry. In this channel, you can find content for dental assistants and for anybody that wants to take care of their oral health. So if you love your teeth, make sure you subscribe to our channel.
And if you're returning back to our channel, thank you guys so much for the support. Please keep supporting us. Don't forget to like this video and leave us a comment below. And today's topic is x-rays.
We decided to pick this topic, x-rays, because it could be very challenging, especially for newbies. You know, it's intimidating when you have to take x-rays on a patient because there's so many things going through your mind.
Plus, patients are scary and they like smell fear from you and they're like, oh, I'm gonna be difficult.
Exactly.
You know, that's how I feel.
Exactly, but there's so many things that it could be in your mind, like, I don't want to hurt this patient. If I take a bad x-ray, I'm going to have to retake it. How embarrassing, how annoying. So we have a few tricks over our career that we found out that works for us, and then just make things a little bit smoother.
Okay, we're gonna get started in taking x-rays. I'm gonna review and give you my tips on taking x-rays on the upper arch. Gabby's gonna be my patient. And I'm gonna play just using the DEXAs. Well, that's what we have, but I'm not taking an actual x-ray just yet. But if you have film x-rays in your office, we can't help you.
No.
Right? I mean, what year is it?
Just kidding. The same tips should apply.
The same applies. We've worked with x-rays before. So with the film,
yeah, a long time ago.
And you know, you probably get better if you start with that, because you don't want to go back
and retake
that and having to process it again. So we're going to use the XCP rings.
And I wanted to say this really quick. A full mouth series should not take more than 10 minutes.
Right.
So you better get it.
Yeah, it needs to,
I would say average is like 6 to 8 minutes. But
it's like depends on the patient.
Yeah, it depends on the patient, but more than 10 minutes, that's a no-no. You gotta hustle and get your practice over and over again, because it should be less than 10 minutes.
Also, the more time you give the patient to think about it, it's like the worse it is. So you like to tell a patient, you pull this out and they're like rolling their eyes. They're like, oh my God, I can't, deal. Oh, can you buckle this up? But make sure they have their apron on. So they just, you need to tell them the truth. Like, hey, this is gonna take me about 6 minutes. I know it's difficult, it's challenging for you and for me, but we're gonna walk through it, And then probably when you start taking the x-ray, start telling a random story to keep their mind going and keep them distracted. And I tell them usually, especially when I'm taking the posterior PAs, is that, hey, if I'm not, the exposure button is outside the room. If I'm not back here fast enough, just after you hear the beep, you can take this out of your mouth. And it kind of gives them a little bit more control, and, they just feel better. Another thing is, with the film, I think it's worse because of the little pointy plastic. But with this one, you can feel it too. I usually don't do it, but they do have this little tabs that you kind of wrap at the edge of the sensor.
Like a little cushion.
It is like a little cushion. I think it's very helpful, especially in the bottom teeth. I don't pull them that much often, but it's an option, because actually I just found out about them like 3 years ago.
You learn something new every day.
You do. All right, so let's start with the posterior arch. Now you're gonna place it, when you just imagine that the sensor needs to be parallel to the teeth, okay? So that when you aim the cone of the x-ray tube, it's also parallel, although that would be perpendicular when the tube is in, but this is parallel to the teeth. So we're gonna go around here. You can stretch the lip a little bit. And let's see, bite down, gently bite down, Gabby. And then you push the ring in a little bit, okay? Breathe in through your nose. you come through and you align it with that. Okay? And then you step out and you take your x-ray. You take this out. One thing that sometimes I've noticed with taking PAs, depending on the arrangement of the teeth on patients, you may get that overlapping. Hopefully you can correct that with the bite wing, but to try to get it, minimize that overlapping, sometimes, and you tell me if I'm wrong, but sometimes I place the sensor and it's like the way the patient bites down, it's
or if
like,
they're missing a tooth,
or if they're missing a tooth,
then
yeah.
it's like it's slanted. Yeah.
So I don't always align this to the ring, because if I see that this is at an angle, I will adjust this to kind of imagine how is it gonna penetrate the teeth. Let me just tell you, show you actually what I'm talking about. I'm gonna place it in one more time. And bite down. And move your head to your left a little bit. So if it's not like this, if it's slightly backwards like that, I would actually align. She's finding that good, so it keeps fighting me. But if this shows in the video like that, I would align this. Imagine it going through. One thing that you can use if you're struggling with the patient biting down properly for whatever reason, they're missing a tooth, it's just, you know, or the plastic is bothering them, you can use a little gauze to help stabilize the sensor when they're biting it down. You could also, I might get a little bit of gauze, have them hold the sensor gently with the tip of their fingers.
Don't be afraid to use the patient. Patient can always help you, like move their position,
right?
Move the chair if you feel like the patient needs to be higher, lower. Don't be afraid to move the patient.
Yeah. So this is, I think the gauze comes in handy when you're taking the canine PA, because it's like at an angle, just that's where the arch starts kind of curving. So I put it just like this. Maybe sometimes I have to do a 4 full, but with 2 it'd be fine. And go ahead and bite down. Keeps it really stable. Open. Let's show them how the patient would hold the bite down. You're like, you got them, you're like, hey, right there with the tip of the finger. And you don't want them to be grabbing onto here or here, or have the fingers somehow blocking the x-ray. And then you take it. We're moving into taking bite wings, okay? That's probably the easiest one. So when I'm close, when I'm about to take it, I tell the patient, okay, we're done. 4 more, these are the easy ones, you know, just kind of like keep the encouragement. This is, again, parallel to the teeth. Do you sometimes have to put gauze, like to keep it safe? The only problem is that if you put a cushion, like how I've been using before, is that with the bite wing, it may not show, right, the upper ones or the bottom ones very good on the x-ray.
Well, the only time that I would have to do it is, like, let's say if you're trying to take an x-ray of a crown, you're trying in a crown and the crown is not stable enough, so then you will put a cotton roll, because really you're just trying to get a bite wing off that tooth.
Of the tooth.
The others doesn't really matter, so then I would use it there.
So it depends what you're taking, you know, if you're just taking an isolated one, you know, just, by the way, if you see that, she's good. I mean, we're not taking an x-ray, but if you see this sliding off the patient, make sure you bring it back up. Or like, make sure your office has the vertical bite wing, because that helps a lot too.
Sometimes you have to use the vertical,
just to get that bone level or the margin. But this
or an implant.
Or an implant, those are tough too to get in the regular bite wing. So put it on, bite down. Excellent. You see the ring is parallel to her face, so this is gonna look really good. You place it parallel, or actually this would be perpendicular to the X-ray at this point, but it's gonna look great. Open. Good. Okay, so I'm done with my part. Now I'm gonna become Gabby's patient, and she's gonna review with you her tips on how to take X-rays, and she's gonna do the lower arch.
I'm gonna go ahead and share some tips on how to take X-rays on the lower. So I think that the most challenging thing on the lower arch is if the patient have torides.
Yeah.
It's gonna be uncomfortable. Sometimes it's gonna be very uncomfortable. So I like to let them know ahead of time.
Yeah.
Okay, there are some torides in there, and you know, just to let you know, it's gonna be uncomfortable. But even if there isn't torides, just because the tongue is there, it tenses up, the floor of the mouth is pushing, it's just not comfortable. So I tell them, hey, the lower is usually a little uncomfortable. Just bear with me. We'll get it done. It will be quick. That way the patient is already kind of expecting it. Okay, so first thing, you want to go ahead and tell the patient, don't do anything with your tongue, don't try to move it, just open your mouth, relax, and I'll do the rest. Okay, so you're gonna go in and you're going to slide this right under the tongue so you can push the tongue away. So under the tongue, you push the tongue out of the way, you go all the way to the back and go ahead and bite down. And you're gonna see that this is straight. It moved a little bit here, but it's still straight. Go in there, take your X-ray. Open. And just like Carla mentioned before, you can tell the patient if it's really uncomfortable. As soon as they hear the beep, they can go ahead and take it out. Definitely for the lower, you might want to add that. What I like to do whenever I'm taking an FMX, so it will go quicker, which I don't know if everybody does this, but this is what I do, is whenever I'm doing, let's say you're going to start on the upper right, because that's usually where you start. So you're going to take the two X-rays on the upper right, and then when you come back from the button, I'm already on this side. And then I go on the lower, because that way you don't have to switch your ring apart. So you go that way, everything is going to move a lot faster. Okay, so let's go ahead and do the interior. And I have another trick for the interior to go fast, is that technically whenever you're done with your PA, you don't have to get it out of the patient's mouth, right? I mean, especially if you have digital, you can just look back, it looks good, you just move it. And you just move it and you keep on going.
Not everyone will let you do that, but if you can get
away with the patient, then it's like super fast. You're gonna push that tongue all the way back so this can go down. And then once you position it correctly, you go ahead and have the patient bite down all the way. And then look at this. So you take your X-ray, right? You look back, okay, that's good. Open and bite down again. You see how I just moved it? And then you take it and then you just move it. So if the patient, if the patient allows you to do that, because sometimes it is super uncomfortable, the patient needs a second. That's understandable. But if the patient allows you to do it, just move along. Now another trick, similar to Carla, where she placed the gauze to stabilize the ring. This is what I like to do, because sometimes with the interiors, you take an X-ray, either the patient bites down too hard, or that's just the patient's bite. You get the whole root, and then you don't get the crown of the tooth. So I like to use a cotton roll. So if you're doing the interior, open wide, you're gonna push that tongue back all the way, and then you're gonna grab your cotton roll. You're gonna put it right here. Go ahead and bite down, and that's that.
Show them how it would look. Like, because you can tell when you're going to take a bad X-ray.
It looks like
you're
this or like this. You can tell the angle where, I mean, you know, it depends. If you're taking a PA for an implant, or, you know, to see a root canal, then it doesn't really matter too much the angle. But, you know, if you're doing an FMX, if you're, you know, you want to make sure you get your angles.
True.
So, that's that. And then I would say the bite wing, Carla.
It's the easiest one. I think you need to show.
Would you say that? Okay.
I mean, still show them, because there's one thing that I learned while I worked at a pedo office, especially with the bite wing, is that when you place it with kids, people are like, sometimes they like do this, right? They like bite with their lips.
Yeah.
And kids love to do that, but if you tell them to bite down and smile, so you're like, it forces them to clench their teeth onto the sensor.
Yeah. So with the bite wing, there's two different types of bite wings. One is a regular bite wing and one is a vertical. So when do you use a vertical bite wing? Vertical bite wing is when, let's say, you're trying to get an implant crown.
Yeah.
Or what else?
Sometimes I want it in the interior, like a bite wing on the interior.
Oh, if you're trying to take like a canine bite wing, you can do that.
Something like that.
So if you're taking a regular bite wing and it's not showing you either the bone level or, you know, the neck of the tooth, something like that, then you're gonna have to get a vertical.
Yeah.
So the vertical is kind of awkward positioning, I have to say. So it's like, okay, well, do you leave the wire on the top or on the bottom? Like, what is more comfortable?
I don't know.
So for me, actually we need to look it up if there is a rule, because for me, I don't have a rule. Whatever feels more comfortable in there, because at the end you're gonna get the same results. So you're gonna go in, open really wide, and so this time I'm gonna leave on the top. And then you're going to bite down, and you wanna see that they are biting down. You see this is straight. You level, and here you are. And open. So with the regular bite wings, it should be smooth sailing. Yeah. Now vertical bite wings, it might be a little uncomfortable, so then you can go ahead and tell the patient, hey, this might be a little uncomfortable, just heads up. Yeah. But it's used, I would say not every day, but you know, you're gonna come across a patient that you're gonna have to take a vertical bite wing.
I want to say, hopefully I was gentle on you, but try to be gentle.
Yeah.
And because I was watching you, and you see when she was putting the X-ray sensor, you kind of angling it inside the mouth. You're not just like open as wide and then put it in all together. No, you kind of have to
finesse your way in.
Yes, that's important. We hope this video was helpful. Let us know in the comment below if you used our techniques and it helped you take X-rays a little bit better and faster, or if you have a tip of your own, let us know also in the comment below. And you can also find us on Instagram, message us there, or Facebook.
While you're on our Instagram, make sure you check out our dental needs and share with your dental people.
Yes.
Make sure, of course, to subscribe to our channel, hit that notification button so you don't miss any of our videos, and we'll see you guys next time.
Keep smiling.